Hello, so today we're going to talk a little bit about speech sound disorders. And so this is a umbrella term that is referring to when someone has trouble making speech sounds correctly. This can include problems with hearing the sounds, physically making the sounds, or understanding the rules for how these sounds are supposed to go together to create words. Some positive implications for this are early intervention, boosted confidence, academic success, having these conversations, learning more about these speech sound disorders creates more knowledge, which allows for students to be identified and receive early intervention. And when they receive this early intervention, they have boosted confidence because their needs are being met, and we are addressing the problem and trying to correct problems that can be corrected. And if there are problems that can't be corrected, they are being taught how to cope with these problems, which then leads to academic success. Clear communication, very important in academics. They need to know how to present information to a group of people. They need to be able to express their ideas and express when they understand something versus when they need help with something. And so having this boosted confidence in this early intervention thus sets them up for greater academic success. And this is all accomplished by us having effective assessment and interventions for these speech sound disorders. Some negative implications are stigma and resource allocation and parental concerns. So students who have these speech sound disorders often face a stigma within the classroom, within their peers, because they have something that's different than their peers. And just like in any other bully situation, that's often what is pointed out. They might often be looked over when people are choosing people for group projects or just interacting in the classroom on a daily basis. Resource allocation is another negative implication, only because we need more specialization and people with more specific skills to address these disorders, and that is not always available. And in a school setting, this is something that is not always viewed as the most important or something that we need to be spending our money on over other things. And the other negative implication is parental concerns. A lot of times parents are anxious or overwhelmed at the thought of labeling their child with a disorder. And so because of this, we need to have very sensitive and honest and open communication with these parents during this time. And we need to acknowledge the fact that oftentimes this is because of the stigma that the child may face. They're apprehensive about labeling their child with this because they know that it could be a difficult thing for their child. And so we need to make sure that they understand simply not having the label does not get rid of the problem that needs to be addressed with their student. That way their student can receive the help that they need and the intervention that they need. To personally connect to this, I want to briefly mention what I talked about in my discussion board, which are some roadblocks that my school system faces as a small rural school, which is limited resources. We don't have the funds or the manpower to address this, and I know that this is not simply us, but this is something that many people face. And teacher trainings. Oftentimes we are not trained on how to identify these disorders and things that might indicate a child has these disorders. And so I feel like these two are things that need to be addressed when talking about this topic overall.